More than half of all people with HIV live in Eastern and Southern Africa. The United Nations organization UNAIDS says since 2010, AIDS-related deaths have fallen by 42% and new infections are down by 29%. But we've still got a long way to go. Globally, 1.8 million people were newly infected in 2016. President Donald Trump's proposed budget cuts would reduce funding for global HIV programs by $1 billion.
At this point in time, they're abdicating their leadership. They're not living up to the global commitments to play a part in curbing the epidemic. And so we are at almost a crossroads, and the U.S. has a decision to make, and that's why we're looking to Congress. Are we really going to allow the U.S. government to abdicate our leadership and responsibility when it comes to our part in fighting global HIV?
Young women in sub-Saharan Africa aged between 15 and 24 are now at greater risk of HIV infection, with a 44% higher infection rate than their male peers.
When you see this youth wave and you see the risk to young women, if in this moment we don't figure this out and really get these programs to stale, we are not going to have the impact on the epidemic we were hoping to have.
The President's Emergency Plan for AIDS Relief, or PEPFAR, set up a program called DREAMS 2 years ago to help girls and young women in 10 African nations. The program recognizes that young women can only benefit from medical progress in treatment and prevention if they're empowered by better education and culturally sensitive healthcare and advice.
There's a whole host of issues, of barriers that they face when it comes to living HIV-free. And that ranges from gender-based violence, especially sexual violence and rape. It's poverty, it's lack of education, it's a lack of opportunities. So there are these societal forces that put them at risk of HIV.
President Trump strengthened rules blocking funding for any groups that deal with abortion-related issues, even if that involves simply providing advice, making it more difficult to support some on-the-ground projects. But advocates here have begun a determined effort to influence members of Congress who must organize and vote on the forthcoming budget in order to ensure that global commitments on HIV funding are maintained. Daniel Renches, CGTN, Washington.